A very good morning to you. I'm Howard Feldman. This is the Sunday Synthesis Podcast with me, Howard Feldman, and of course, Dr. Anton Meyberg. As you'll notice today, we are coming to you from the Hatzolah in Johannesburg. It's their vaccine site. Absolutely incredible to see. Lines of people queuing to get their vaccines, an incredible energy, huge efficiency, and just an amazing experience. South Africans of all walks of life coming out to get their vaccines. We're going to take you through a little bit of the process this morning, and Dr. Meyberg will explain how it works, and of course then we will get to answer your COVID-19 questions. Dr. Anton Meyberg, good morning. How are you?
Good morning, fine and you, and it's really a privilege to be here to see what's going on at ground roots, at ground level on the actual vaccination site and at the Hatzolah Vaccination site. Thank you to Hatzolah for inviting us to record here. It's really nice to see how it actually works. And what we've noticed this morning is there's queues and queues of people that are queuing up here to get vaccinated. People stay in their queues, they get registered on EVDS, they go up to their certain docking points where they are registered further and their details are taken. We've seen there are places where the vaccines are stored. Here are examples of the actual vaccines that have been used. You can get 6 vaccines from each vial. They're diluted with the intravenous saline. And the vaccines are actually brought from the cold storage rooms at that Hatzolah site to here in these cold storage boxes with temperature gauges to monitor the temperature throughout the whole process, so they've got everything done according to the government and the Department of Health's strategies and needs and levels, what they want them to have them at. So once you come through here, you get your vaccination, and then you get your mandatory 15 minutes waiting to see that everything is okay before you go home. So highly impressed.
Do we know how many vaccines Hatzolah has done?
So up until this point, they've done 13,267, but I think within the next 10 minutes, there'll be probably about 15 or 16,000 the way they're going at the moment.
Absolutely incredible. All right, we'll come back to the whole vaccine process. Let's just start off as we normally do, getting a sense of how the numbers are looking, how we are doing in South Africa and of course around the world.
So currently there are 220 million cases worldwide with 4.5 million deaths and 197 million cases resolved. The United States has 40 million cases with 665,000 deaths. India has 32 million with 440,000 deaths. And South Africa has 2,814,014 cases with 83,333 deaths and 8,411 new cases in the last 24 hours. A 15.5% test positivity rate, which has gone down.
Right, I think last week, I think you said it was just around about 20%.
Right, so we're actually going down between lower than 10,000 cases a day, the 7-day national rolling average. Gauteng hospitals, there's 3,303 COVID patients in hospital, with 615 in ICU and 350 currently ventilated.
Right, and how's your hospital looking? What's the sense of what's happening at the hospital?
So it's actually very eerie at my hospital at the moment. We've got essentially one ward with 10 patients in.
Incredible.
It's unbelievable. We're actually starting to doctor again.
You were up to what, like 60 at some point?
It's at one point we're over 140, 150 patients.
Wow. Okay.
We're now down to 10 patients.
Incredible.
It's unbelievable. Some of the patients are there are long-staying patients that's been there for a while, but overwhelmingly an unbelievable change from what it was a few weeks ago.
And is the rest of the country following? I know Gauteng was one of the first to hit
So the rest of the country is following. They're taking a bit of time. Unfortunately, the numbers are still very high in KwaZulu-Natal. They're starting to come down in the Western Cape, although they're high. The numbers are still high there, but we're definitely seeing overall the national numbers are coming down dramatically.
Okay. We've started to receive, and it's obviously an indication as to where we are in our COVID life cycle, but we're starting to receive more and more questions around long COVID. A couple of times last week, I spoke to people who are suffering tremendously from fatigue, from headaches, from I think post-traumatic stress or anxiety, depression. What are you seeing? Are you starting to see a lot more long COVID sufferers? And is it a real thing?
So there's no doubt it is a real thing. As I've said previously, clinics overseas are making actual long COVID clinics. It's called PASC, which is called post-acute sequelae of SARS-CoV-2. That's just the big name for it. That means in English long COVID.
PASC.
PASC, P-A-S-C.
Well, that's a cool new word we're going to learn. We've learned because, we've all become virologists during this time.
Virologists, immunologists, Googleologists. We're all being very good at this type of thing.
Right. Okay. So PASC is the thing.
PASC.
Write it down. Use it at dinner. Everybody's going to be impressed with you.
Yeah, 100%. So we're seeing there's a lot of neurocognitive problems, a lot of cardiological problems. There's cognition problems, memory problems. The most important one is people say they talk about this brain fog. There's loss of smell, loss of taste, cardiological problems, pulmonological problems, people having respiratory problems with inflammation in their lungs, breathing issues. This is going to take a long time to settle down. One of the biggest studies shows that the way to combat the long COVID is to get vaccinated post your COVID.
Oh, that's interesting.
And it does show that it definitely does decrease the efficacy or decrease the actual sequelae or the consequences of your long COVID. So it's something to think about and something to know about. There are many, many benefits to vaccination, and one of them now is being heralded as long COVID as part of your benefit.
Is there any other treatment, or do you just treat it symptomatically other than that?
There are a lot of treatments that are on the horizon. A lot of things you've got to look at, the case-specific or organ-specific things that you're dealing with. So if you're dealing with pulmonological things, if a person comes in with inflammatory lung disease, with fibrosis in the lungs, you're still going to treat them with corticosteroids. You still can decide if you want to treat them with colchicine. You're still going to nebulize them. You're still going to give them inhalers to use. If they've got neurological things, you've got to decide if you're going to use trepoline. There's new studies to show that for long-term headaches with COVID, you can even use drugs like theophylline, which is a drug used for respiratory conditions. So there are little tricks to the trade of what to treat people with and how to treat them with long COVID. And we're learning more as we go along.
Right. Well, as it becomes, and do we know the percentage of people that are suffering from long COVID?
We don't, but it's still too early to decide that. We've got to wait and see how many more people actually present with symptoms and when it actually can be considered long COVID. Is it after 6 weeks? Is it after 8 weeks of having COVID? So these are still things that are going to come out in the studies as we go along.
Right. Okay. Let's just talking about vaccines. We had a number of questions around vaccinations and pregnancy as well as breastfeeding. I know that you've said before it's safe. Can you just give us the ideal timing with regard to vaccines and pregnancy? Somebody sent us a question saying that if you've had your first vaccine, your first Pfizer, then became pregnant, what do you do? How long do you wait? Give us a sense of what the latest information is.
A while back when we were still trying to understand the effect of the vaccines on pregnant people, on the fetus, on breastfeeding, we were under the assumption that you shouldn't have your vaccine until after 14 weeks of pregnancy.
Right.
The thought process now, according to the American Association of Obstetrics and Gynecology, according to the United Kingdom associations, is get vaccinated now. There's no time to wait. Do it now. The benefits of being vaccinated in pregnancy far outweigh the risks of the vaccination. And unfortunately, any doctor who's been involved in frontline medicine treating patients who are pregnant and have patients who have COVID know the detrimental effects that COVID can wreak havoc on the body. Unfortunately, we've lost patients who are pregnant who weren't vaccinated, and not through their own fault, but because they weren't old enough to receive the vaccine. Right. Now with people over the age of 18, it's a no-brainer. Get vaccinated. If you're pregnant, get vaccinated whenever you can, as soon as you can,
so it doesn't
and then
matter
wait
where.
your 6 weeks, wait your 42 days if you're having your Pfizer vaccine. At this point in time, I still personally would recommend the Pfizer vaccine over the Johnson & Johnson in younger people, for pregnant people who want to be vaccinated, but there are going to be far more studies going forwards with regards to that.
Right, so I think that is very, very, very clear about that. A lot of people also asking about the when we'll hope to start vaccinating those younger than 18.
Look, I mean, in the United States, as we've said, they're vaccinating over 12-year-olds. The way things are going here, I can't see why we haven't started vaccinating over 12-year-olds. I'm assuming that as we get more impetus and as we carry on with the vaccinations, within the next month or two, hopefully by November, they will decide to start vaccinating the over 12-year-olds. We live in hope. I want my kids to be vaccinated that are over 12.
Right. And the third vaccine, the boosters that we're seeing starting to happen in Israel and the United States, when do you think that this will become necessary in South Africa? After how long, really,
so
I guess,
that's a good question,
is the
because
question.
It's now noted in the United States and in Israel that in order to be called fully vaccinated, you need to have the 3 vaccines. You have to have the 2 Pfizer plus a booster, or you have to have your Johnson & Johnson plus either Johnson & Johnson or a Pfizer. They still haven't given us the feedback whether or not you have Johnson & Johnson or Pfizer, but you have to have all three or a double dose for the Johnson & Johnson in order to be called fully vaccinated. So I think that the government are on track, the Department of Health are on track. They're realizing that we are more than 6 months down the line and that medical professionals need to be vaccinated and get their boosters. And I think a lot of people have lobbied towards the government to get this going in the right direction.
All right, so let's start taking a look at some of the questions that we have. And again, thank you as always for your tremendous input. All right, Louis wants to know, well, he actually says, please can you ask Dr. Liverpool? I'm assuming that's you. I didn't realize that was your other name. What or why would my oxygenated blood level be unmoved at 6.8 for 5 days? Louis is suffering from COVID. He's in hospital. He had the one vaccine and then became ill. He says, while on oxygen, my levels are 95 to 98%, but without the oxygen mask, it drops to 85%. Why would that be, and what does that mean for Louis?
So first of all, we wish you better, Louis. We hope you get better soon. Hopefully COVID will give you brain fog and you will start supporting a real soccer team like Liverpool, because wow.
Right.
Now, what we're hearing from Louis, he's asking about his oxygen levels, his oxygenation levels, and he's speaking in a different language to us all. In South Africa, and we can read in inverted commas, in Johannesburg, we use millimeters of mercury. So we normally look at your oxygen levels of 80 millimeters of mercury, 75 millimeters of mercury to be above that. In Cape Town, or read as internationally, we use kilopascals. So he's looking at about 6.5. We'd like it to be above 9.5, above 10. And what he's basically saying is that when he's on oxygen, his oxygenation levels are high. But as soon as you take the oxygen off, his oxygen levels are low. And that means he's got inflammation in his lungs. He's got COVID lung disease from getting SARS-CoV-2. And he's got a process of what we call a pacification and inflammation in the lungs, where there's not able to transfer oxygen through the lungs, and therefore he needs supplementary oxygen to help him through this process.
All right, and of course, as Dr. Liverpool said, wishing Louis Carpus a very, very speedy recovery. Richard says, we had family come from overseas and we were staying with them in a holiday home. They were showing symptoms, so I convinced them to get tested, and in fact, they turned out to be COVID positive. My wife and I have had COVID 2 months ago, and then we had our first Pfizer 2 weeks ago. Is there any chance that we could get COVID?
So as I said, we're now changing things to what called fully vaccinated. Fully vaccinated is now 3 vaccines. So ideally, there shouldn't be an issue. But according to the CDC, if you've had both vaccines, the CDC is the Center for Disease Control in America, if you've had both vaccines and you come into contact with somebody who is COVID positive, then you should ideally wait about 5 days before you get tested and test. If the test comes back negative, you should be okay. In that whole time that you're waiting, you need to wear a mask amongst people inside and outside. As we know, overseas, people aren't wearing masks as much as they should be. And that's one of the reasons why they're seeing an uptick or an upscaling of the actual disease. In fact, just to sort of sideline from that, there's a real world study that was done, and this is completely gobsmacking. It was done in Bangladesh. And I know you're probably going to fall off your chair when you actually hear the answer to this, but there was a test of face masks done in Bangladesh, and it showed, and don't get upset when you hear this, it actually showed that masks work to reduce community spread of COVID-19, and that surgical masks are more effective than cloth face coverings.
Why have you never told
Go
us
figure
this?
it. I mean, who would think?
It took a study in Bangladesh. Well, thank you at least
So back to that person's question. They did the right thing. They should have gone away from the people when they tested positive.
Which they did,
and they should ideally isolate for 10 days. As I say, we can hold the sort of point that they can test after 5 days. If they're negative, they should be okay. But we're still in a different position in South Africa compared to America. We still don't have enough people vaccinated. We still need a higher cohort of our communities vaccinated so we can protect each other. So rather be safe than sorry at this point in time.
When you speak about 3 vaccines, I mean, that's on the Pfizer. If somebody's had a Johnson & Johnson, what does that mean?
So
How many
we know
do they
that
need?
people who have had a Johnson & Johnson are going to need a second, what we call booster vaccine. It won't be 2 vaccines. It will either be a Pfizer or a Johnson & Johnson. We're still waiting for the findings from the international bodies, which one they're going to recommend.
But either way, probably either one of those will be fine.
100%.
Okay, good. And Ryan wants to know, could the doctor please detail treatment available for people once they have the onset of COVID-19?
Okay, so Ryan, that's a very good question. There's no magic bullet to treatment when you get the onset of symptoms.
What about ivermectin?
So, interestingly enough...
or we'll come back to that.
While you're asking about ivermectin, a new study came out where they studied ivermectin in rats, and it found that it decreased the fertility and it decreased the testosterone levels, and it worked on their gonads. So you want to go ahead and stay with ivermectin.
Are you making that up?
I'm not making it up. It's a real world study that's
really?
Done that. It was tested in rats, and so carrying with the anti-vaxxers and the ivermectin, and good luck with your fertility. Hashtag not mentioning any names.
Right, okay, well that's
so basically back to Ryan's question is that there's no magic bullet. There's no medicine you can just take that's going to stop your symptoms. But if you are COVID positive and your oxygen levels are low and you've got inflammation and you need to go to hospital or you put on oxygen, the highest benefit is for going onto corticosteroids, something like dexamethasone, which we know has been shown to benefit people. Oxygen, anticoagulation with injections or with tablets. And then, of course, your vitamin packs. There's lots of talk about which vitamins, but the general vitamin packs, the vitamin C, the zinc, the thiamines, the niacins, the colchicines, they all can do something. Whether or not their role is completely insidious or they've got a great sort of role to do everything we don't know, but working together, they play a big part in the actual treatment of this disease.
All right. So that's,
of course, we also know that we've spoken about previously about monoclonal antibodies, and there's a lot of talk about monoclonal antibodies, about baricitinib and all these other types. And as I say, unfortunately, in South Africa, we don't have that modality of treatment.
Okay. Margot wants to know, and it's an interesting question. I assume that that if a COVID-19 vaccine, which isn't stored correctly, can be ineffective. But what she wants to know is, can it actually be harmful to you?
So the truth is, it can be harmful in a way that you're getting a false sense of security because you think you've been protected and you're not protected. And that's the whole point of the cold chain, of the temperature gauges, of the cold boxes, of actually keeping the vaccine at the right temperature so that you can administer the vaccine when it's given at the right temperature so that it works effectively.
Michelle says, if one has had surgery, how long do you wait until you get your first vaccine?
So generally, if it's minor surgery, you can wait about 2 weeks. With major surgery, you have to wait at least a month, 30 days.
Gail wants to know, if you had the J&J vaccine in March, you were seriously ill and hospitalized for 2.5 weeks with COVID, how long should that immunity last?
So you've now almost, if you've had the J&J and you've had COVID, it's almost like you've had your booster. Now you should have immunity for about 6 to 8 months. But remember, the immunity we're talking about is not discussing your T cell immunity and your B cell immunity. And that's very important. There's not enough studies out to show when that immunity will wane. We do know, however, that, or we think or whatever, that people who've had the Pfizer and have had COVID, who've recommended not to have a second Pfizer, down the line now they are going to need a second Pfizer because that will be part of the third booster type thing with them.
I think I read that a study that came out of Israel showed that your best combination was to have had a vaccine and COVID. Is that?
So I think there's a lot of misconceptions with that. In other words, people mustn't think that the best answer is to get the virus. That's not the truth. The best answer is to get the vaccine. One of the better options is if you've had the virus plus the vaccine, your immunity is through the roof. But we're not promoting that you go have virus parties and try to get infected so that you can get the best of both worlds.
All right. Are there any, in terms of medication, is there any new medication coming out?
Look, there's always new medications that are being touted from Israel on very small studies on like groups of 10 to 20 people. That's not enough to be called peer-reviewed. We're waiting for more studies from all these type of things. They are talking about oral vaccines, which they want to make, which will be a game changer for people going down the line. And at the moment, there's nothing dramatically new that can change our actual treatment. We're still dealing with the tocilizumabs. We're still dealing with the steroids, with the anticoagulation. We're still dealing with the same cohort of medications.
Right. How are we doing in South Africa in terms of vaccine, I'm calling it vaccine hesitancy. I'm not calling it anti-vaxxers, because I seriously believe that most South Africans aren't anti-vaxxers. They might just be a little bit hesitant or nervous. What are you seeing in your day-to-day practice?
So what's very interesting is now that we started working in the rooms again,
yeah,
I'd say about 99% of the patients I'm seeing are fully vaccinated or are
That's
vaccinated,
interesting.
which is very interesting to see, because that's the type of patient that's coming for.
I was just going to say, doesn't that talk to a patient who's going to
Yes,
see their
but
physician pulmonologist?
I'll tell you what the issue is, that 1% of patient that's coming to see us is not an anti-vaxxer. It's a patient that's hearing how bad the vaccine is, what the bad effects are, and are totally uneducated and are being misinformed by the public for some reason. And what needs to be done is there needs to be a drive on education on how to vaccinate people and why people need to be vaccinated in their own internal languages or their own sort of ways of understanding why it is important and how important the vaccination is.
Yeah, and I'm sure even more so once we start getting to the youth, the 12 to 18-year-olds, I would imagine.
Yeah, you see, that's also a very good point, because we got to try and understand why children don't get as sick as adults. And we know that the majority of children have got less comorbidities like diabetes and obesity. We also know that the nasal passages have got less ACE2 receptors that the coronavirus can get into the cells. And the airway cells show differences that may prime them to detect the virus earlier. So despite the fact that their immune systems are less developed, it means that they don't get such a virile or virulent cytokine storm if they do get infected. And that all plays a part in why kids don't get an as bad affectation of the disease. That being said, it doesn't mean that kids shouldn't be vaccinated. Anyone over the age of 12 needs to be vaccinated. We're seeing this all over the world now, that children are now transferring the virus to the elderly parents, or coming home from school and giving the virus because they're not following the rules, they're not wearing masks, they're not socially distancing. So children can definitely transfer the Delta variant to older people, and you still have to be extremely careful.
Last week you told us about this variant of interest. It wasn't quite a variant, if I recall correctly. Any new developments on that?
So, you know, we're hearing the whole time, why does South Africa always have to take the benefit of calling themselves the leaders of the variants?
Because we've got a high standard.
100%. There's lots of variants coming out. There's the Lambda variant. There's the Mu variant from Colombia.
Yes.
There's so many different variants. What we know about this variant, the C12, is that it was picked up in January as the C1. It's now known as C12. There's been very minimal cases of it being picked up, but we've got to watch it. It's a variant of interest, but it's not causing major havoc at this point in time. And please God, if people follow the rules and they avoid social parties and they avoid all the bad things that they're not supposed to be doing, and they keep wearing the mask, we will contain things like this.
How long do you think we'll be dealing with this for? I just want to know when, dealing with this whole COVID thing. I just want to know when I'm going to get my Sunday mornings back, really, is what I was asking.
We're going well into next year. There's no doubt about it. We're still going to be wearing masks in December. We need more people vaccinated. We need the boosters. But hopefully into next year, we'll be in a different position. We'll be in a position like the United Kingdom are in.
Right.
Where they're starting to live life again.
Normal, have a relatively normal life.
Right.
It is incredible to see what a lot of our community organizations are doing. Of course, we're seeing phenomenal vaccine drives at the major hospitals. We're seeing it across the country, but we're also seeing the Muslim community, the Jewish community, churches. We're seeing really just the most amazing thing. And sitting here at Hatzolah today, it is just remarkable to see how involved community organizations are in this drive to help people get vaccinated. To me, it speaks to the uniqueness and the magnificence of who South Africans are. What's your impression when you sit at a site like this?
I just say #blessed. I mean, there's no other word for it. When you look around, when you see the droves of people that are standing in queues, there's a vaccination site here, there's a vaccination site down the road. There's so many vaccination sites going around. There's so many people that are keen to be vaccinated, that are being vaccinated. And we've got community organizations that have taken it upon themselves to vaccinate the community, to care for the community, to look after the community, to show that they care, to show that we care, to actually get things going in the right direction.
It's absolutely remarkable. And thank you to all of the community organizations that are doing just such amazing work. I'm assuming there is good news.
So there's great news. We're sitting outside. on a beautiful day, albeit a bit overcast.
Yeah, more or less
it's the first time
beautiful.
we've sat outside since December, but
Yeah.
you know, it's great. The numbers are going down. People are starting to live a bit. People are living with a bit of more, in inverted commas, chutzpah, going out there. But just remember, you've got to wear your masks. You've got to social distance. You've got to obey the laws. We're now going into the Jewish holidays. You've got to make sure that you you keep your masks on. And this is not only for the Jewish holidays. If you're having functions, keep your masks on at the functions. Obey the laws. You have to obey the laws. Separate your tables at your religious meetings. You can do all of that, you can move forward with all of that, and you can live life properly. And just to quote, as I end off my quote, and the theme will be with regards to the Jewish New Year, today is not just another day, it's a new opportunity, another chance, a new beginning. Embrace it. Shana Tova to everybody, wishing everybody a good New Year.
Thank you, Dr. Anton Meyberg. I'm Howard Feldman. We have been recording live at the Hatzolah in Johannesburg, their vaccination center. Phenomenal. As I said before, absolutely phenomenal to see. Please don't forget to subscribe below and send us your questions as we continue to provide you with as much information as we are able to do. Wishing all of our Jewish viewers a Shana Tova, a happy, healthy and prosperous New Year. May we all be blessed, not obviously just our Jewish viewers, but everybody. May we all be blessed with health and with only good things in the year to come. I'm Howard Feldman. This has been the Sunday Synthesis Podcast. Have a great week and God bless.